Okay, so we are going to do a PICC line dressing change today. So what you would need is your PICC line or central line dressing kit. You would need your tape measure. You would need a stat lock for the PICC. Make sure that you have the PICC Plus. Extra sterile gloves, flushes, needleless connectors. You would change all of them. Alcohol caps, alcohol wipes, and a Sharpie. And then you would also want to have a second person with you. Your second person is going to need a mask and gloves. Your second person can help stabilize your PICC while you're changing the dressing. They're also going to call you out if you break sterile technique. They can be of an assistance, so make sure you have a second person, and you're going to document that too, that you had that second person. If your patient was to be allergic to Tegaderm or to CHG, you can reach out to Vascular Access to get these dressings, and they will help you with that. So put these aside. All right, so you're gonna go into the room, you're gonna hand sanitize, you're gonna say, "Hi Jenny, we're here to change your central line dressing change. This is my second person, Ellie. She's gonna help assist me." First, you'd wanna make sure that Jenny's arm is in a good position for changing it. You'd wanna make sure that all the clothing is out of the way so that you have a good work area. Does that feel okay, Jenny?
Mm-hmm.
Okay, so we're gonna hand sanitize again. Clean off your bedside table. If your bedside table was covered in stuff, you want to make sure that you're cleaning it off, clearing it up. You're going to use the table. You'll move all of their stuff off, clean it, and then put it back at the end when you're done. So you're going to open your kit. Make sure that you get the glue out of the kit. It's on the front. There's your glue. Open your kit. So your kit's gonna walk you through it. First step is you're gonna put a mask on you, a mask on your patient, and this would be the time where your second person would also put a mask on. So Jenny, I'm gonna put a mask on you just so that we don't get germs on your line. Does that feel okay?
Mm-hmm.
Okay. Hand sanitize again. You're going to put your gloves on. Now the kit recommends sterile. It doesn't have to be lip and cut since this is just a clean procedure to take your dressing off, but we're going to utilize the gloves that are in the kit. So you're going to use your detach all. You're going to pop this open and just start working at the dressing to get everything off here. You're going to work all the way around the dressing, working your way up towards the insertion site, going all the way around, loosening everything up. You doing okay, Jenny?
Mm-hmm.
Okay, when you get to this point, you want to make sure that you peel these off separately. Okay, now that you can get access to your line, you're going to stabilize your line, pull up towards the insertion site so that you're not pulling your line out. Just like that. At this point, you're going to want to make sure that your line looks okay. You'd be looking for drainage, redness, lots of swelling. So at this point, your second person is going to put on sterile gloves. I'm gonna work on getting the stat lock off. And in order to do that, you need to hold down on your central line, pop your doors open. Try not to let your line wiggle too much. Just carefully peel up on the edges here. Okay. At this point, you're going to trade out with Ellie, and Ellie's going to hold my line for me. So I'm going to take my gloves off, hand sanitize. So Ellie is holding my line. I'm going to open up this tab that says get out your gloves. Before you put on your gloves, you're going to open up your kit, and you're going to drop everything that you would need onto your sterile kit while Ellie is holding your line. So you're going to drop your stat lock onto your field. You're going to drop your glue onto your field. So your glue gets dropped onto your field. Now, at this point, hand sanitize, put on your gloves. Of course. So my second person is holding my line. Now we have our sterile gloves on, our kit is open. We're gonna start at step 1, which is to crack your chlorhexidine and start scrubbing. This is a 30-second scrub. You're gonna make sure you start at the insertion site, really scrubbing that area, working your way around the line, all the way around, all the way up to anywhere that your catheter could potentially touch. Really scrubbing, making sure that you scrub all the lumens of your lines too. Really doing a nice scrub, letting that dry. Step 2 is you're gonna get your glue ready. So you have to wait for your CHG to dry. But once your CHG is dry, you'll pop your glue down, and you're gonna put just one tiny drop right at the insertion site to help stabilize your catheter. Next, while your glue is drying, your mastostol is placed in the wrong step, but it goes in step 3. And this gets cracked, and you're going to just draw a border around where your dressing will go. Okay, and then you're gonna let that dry. Next is we're gonna put your stat lock on. So we're gonna slide your stat lock in. So Ellie's gonna help lift your line. You're gonna slide your stat lock in, insert your holes into your perfect. And then this is the point where you're gonna lift up, close the door so that you're not hurting your patient. Close it with your line lifted up slightly. Pull these tabs. Okay. There you go. Now, at this point, you are no longer sterile. So this is where you would need a second pair of gloves because you have touched the patient, you've manipulated their skin, so you need to change your gloves. So you're gonna take your sterile gloves off, hand sanitize. If you didn't have a second set of sterile gloves, you could ask your second person to run and grab them for you. infectious disease did say, when in doubt, change your gloves. So if you think that you have touched the skin, you think that you have broken your sterile field, please make sure that you put on new sterile gloves. So now we're going to take our dressing, peel this off. You're going to make sure that your CHG window is going to go right over your insertion site. So not so much worried about your stat lock, but getting right over the insertion site and covering that. You're going to pull your lumens of your line out so that they fit in this hole here. You're going to press down a little bit and give it a little bit of a rub to kind of get it to adhere to the skin. Pull up. This second piece here goes up under your tail of your line and helps close the gap here. And then make sure that you use this piece that is used to close this last hole in your dressing. And then you're also going to date it. The date should be the date that you changed the dressing, not the next due date. So this is the date that you actually changed your dressing. You'd also want to include your initials. At this point, if you wanted to take off your mask and your gloves, you could. Jenny, you did a great job. We're going to take your mask off now. All right, so another thing that you'd want to do on dressing change day specifically is measure how far out your catheter is for the external length. So in centimeters, you're going to get your tape measure up here and measure, which ours looks to be about right at about 1 centimeter out. You'd want to cross-verify that with your charting to make sure that it's not more than 2 centimeters pulled back. If it was, you'd want to notify the provider, not use your PICC line until you've verified placement too. So we're changing out the needleless connectors. We've primed our needleless connector. We're going to take off the old one. You're going to scrub this for a good 30 seconds with your alcohol with gloves on. Give it a good scrub. Let it dry. We'll put this in once it's dry. Give it a flush. Make sure that you can draw back bud, flush it, lock it, apply your alcohol cap to your line, and you would do this for however many lumens you have. You need to change out all the needleless connectors and all the alcohol caps when you do the dressing change. Okay, so another thing that if you felt like you saw some swelling or you were worried about your PICC line is you could measure the arm circumference. Lippincott says that you should do that if clinically indicated, so you would look for signs. If you notice signs of swelling or anything like that, you would measure. So to measure, you're going to go right at the insertion site, and we're going to go around Jenny's arm in the centimeters on your tape measure. And this one is right around, it's in between about 36 and 36.5 centimeters. So I would probably document 36, cross-reference with the chart and see how it looks. So now we're going to talk about what you should be doing every shift with your line now that our dressing change has been done. So every shift you're going to want to make sure that you know the reason you have your central line. Are we still using that central line? If you're not using it, you want to talk to your provider about getting it out, switching to oral medications if you can. Getting the line out as soon as possible would be the best case scenario. So checking your dressing, you want to make sure that your edges aren't peeling up. If it is starting to peel up, you need to consider changing it. If it's peeled up all the way to this window, then you definitely need to change your dressing. If you check the CHG pad and it remains indented, that means there's fluid under here. That means your dressing needs changed. If there's lots of blood in here, you need to change it. If you're missing, you don't have a date or some of this is missing, you need to change your dressing. If these needleless connectors are full of blood or debris, you need to change these out. Otherwise, they can be changed every 7 days with your dressing change.